New videos every day.
Have you been diagnosed with ADHD, or has your child been diagnosed with ADHD? Or maybe you know someone, whether it's yourself or a friend, family member, or child, that you worry may have ADHD. Well, today we're going to talk about that very subject, ADHD, and the symptoms associated with the most common treatment, which is medication. And then we're also going to talk about alternative therapies and treatments that have actually been known to cure the symptoms and ADHD itself. So that means with these treatments, no medication, no long-term side effects, no symptoms of ADHD throughout their life, and this is actually curing the problem, not covering up symptoms. So let's first touch on some statistics, because truly the diagnosis and treatment of ADHD has skyrocketed. It is really in epidemic proportions. And in fact, and these are some old statistics, but it says 1 million children are taking ADHD drugs every single day. And that number actually doubles every 5 to 7 years, and it's projected to continue that way. So we actually have exponential increase in the amount of drugs that kids are taking for diagnosis of ADHD. Now here's something you may not be aware of. The U.S. population is 2.5% of the entire world population, yet we are the ones consuming 80% of the available psychostimulant drugs. So we have this tiny little population that's consuming this mass majority of these types of drugs. Now I know some people like to blame genetics on ADHD and they can't do anything about it, it's in their gene pool, but why is it that America has the largest and most diverse gene pool and we're still the ones consuming these ADHD drugs? Now I want to talk about the side effects of these drugs because they impact every single organ in our bodies. These drugs act on our nervous system, which in turn regulates our whole body. So it's going to impact our heart, our lungs, our kidneys, our liver, our circulatory system. All these things are going to be impacted from this drug. Now here's a list of some of the side effects. Restlessness, tremors, anxiety, insomnia, which is actually very common, diarrhea, allergic reactions, high blood pressure, tics, nausea, psychosis, hypersensitivity, anorexia, and weight loss. Now here's something that really freaks me out because these drugs are not approved for preschool age children, yet they are prescribed off-label to this age group. And these drugs significantly impact development. There was a statistic that showed that children taking these ADHD drugs were 20% shorter and 55% lighter for their age group. So obviously there is a huge impact on the growth and development of children, and if they take these long term, it's going to impact their health over their lifetime. Now these ADHD drugs are what are called Schedule II narcotics. They are in the same category as crank, methadone, speed, cocaine, morphine, and opium. So these are addictive drugs, and we are giving them to our children. Now, I'm sure you've heard the stories. Middle schoolers snorting their Ritalin to get high, high schoolers selling it illegally to their friends, college students buying it kind of on the black market so they can stay up late and study, cheerleaders taking it so they can keep their weight down and so they can stay pepped up. And actually, there was an article out of Japan that talked about how they're having to clamp down on the diagnosis because these drugs are being so abused. People are actually breaking into pharmacies to steal these drugs, and people are lying about their symptoms so they'll get diagnosed with a disorder or with a disease so they can get these types of prescriptions. So these drugs are addictive, and people are going out of their way and doing things illegally to get these drugs. So I want to talk about alternative therapies for a minute because I really think that there is not enough attention paid to alternative treatment versus traditional treatment for ADHD. And traditional treatment is medication. These are addictive medications with long-term side effects. So I think that the majority of people have, if they have a safer option to treat hyperactivity and behavior disorders, I think they would choose the alternative therapy. So we're going to talk about that. There was recently an article out of Canada that said that 5% of school-age children have a disorder called Convergence Insufficiency, or CI, which is a vision problem. And it actually has this very similar symptoms to ADHD, so it's led to the misdiagnosis of children. So they're told they have ADHD and they don't. They have a simple eye problem that's very treatable. So the first thing you need to do is, if you think your child has ADHD, they're exhibiting symptoms that are similar to behavior problems, hyperactivity, take your child to get an eye exam, and that could be a very simple alternative to your child taking unneeded medication. The second alternative I want to talk about is omega fatty acids, specifically the omega-3 fatty acids. These are found in salmon, halibut, trout, and flaxseed, just to name a few sources. And there was a study that was out of Britain that took children and gave them 750 milligrams of omega-3s on a daily basis, and the results were dramatic, is from what the scientists said. And they said that their learning improved, their concentration improved, their behavior problems were significantly reduced. So that's just evidence right there that if we supplement the child's diet with omega-3 fatty acids, especially if they're not getting any in their diet whatsoever, it can have a big positive impact on how they're learning and their behavior. The next alternative treatment is to make sure that your child's iron levels are normal and that they have enough iron in their diet. There was a study out of the Pediatric and Adolescent Medicine Journal, and it talked about that 84% of children diagnosed with ADHD in the study had low blood iron levels. And the way that iron impacts ADHD is low iron creates an abnormal dopamine reaction, which leads to the ADHD symptoms. So something as simple as supplementing your kid with enough iron in their diet, making sure they're getting the food sources of iron, can keep them from having to take long-term medication. The number 4 alternative treatment is to make sure that your kids are not eating a toxic diet. And by that, I mean that you're minimizing their exposure to artificial ingredients such as artificial food colorings, flavors, chemicals, and excessive amounts of sugar. Dr. Alexandria Richardson is an Oxford University scientist, and she said in an article that kids are what they eat. And I firmly believe that, especially if the kids are eating a large amount of sugar and things that we are not used to eating. Back in the early 1900s, we weren't eating all these chemicals and additives and things that actually aren't even approved and have extensive testing. And I did make another video. It's called the ADHD Warning, and it talks more in depth about the risk of artificial food colorings and ADHD symptoms. Number 5 alternative treatment for ADHD is exercise. Now, ADHD is characterized by hyperactivity, and kids are meant to be active. So if they are living a sedentary lifestyle, especially in our day and age when they're sent to school to sit down in a desk for 8 hours, their bodies aren't actually supposed to be that sedentary. So if they don't have an outlet to be active, they're going to express hyperactivity sometimes. So it's important to make sure that they are part of an exercise regimen on a daily basis. And it doesn't have to be that they're going to the gym, but they're maybe involved in sports, or they're, playing outside, something besides staring at the television when they get home from school and playing video games. That's not a good outlet for them. And number 6 alternative therapy for ADHD is general nutrition, a balanced diet. And that really is a no-brainer. If the kid is eating junk food all day long and they're not getting their fruits and vegetables, they're not getting the nutrients they need. And if that's the case, their body's not going to work properly. So they, are more susceptible to exhibiting symptoms like behavior problems and lack of concentration and problems and symptoms that are similar to conditions and disorders out there. So just the simple act of providing a balanced diet to your child can make such a difference. Now, there are several factors that influence hyperactivity and a lack of concentration, and one of them is not a lack of Ritalin in the brain. These psychostimulant drugs are not cures. They don't address the real cause of the problem. They just cover up symptoms. Now, one alternative therapy may not work for you. It may be a combination of several, or it may be one specific one that addresses the cause. And if you find a therapy that addresses the cause, you're not going to have symptoms and you don't have to deal with the side effects. So ultimately, the choice is yours. On the one hand, you can take psychostimulant drugs that are highly addictive, that have very bad side effects, including stunted growth and development. Or on the other hand, you can seek out alternative solutions to your symptoms, not have side effects, and not only will it address the symptoms of ADHD, it's going to improve your overall health. The choice is yours. Thanks for watching. Leave your comment. Please rate the video and take care of yourself.